She wouldn't stop bleeding and bleeding. It was the herb. We find it after the fact, but it's too late because that herb thinned out her blood so much. It just keep on oozing through the wound. So herbs interact with medications. They have side effects. So that's part of the reason today why I'm going to divide that into three categories. When I say thumbs up, green light, this is you can take on your own, you're not really taking risk. And then I will describe a second category where I will say there are some positive studies, research is not extensive yet, but it does seem to be working, but the side of safety profile is not that good, or it's just unknown. So if you must take it, maybe consult with your physician or someone who knows herbs. Traditionally trained physicians like myself are not really familiar with herbs, let's face it. So you have to find someone who is both a physician as well as familiar with these things. So that will be the second category. You want to use it. I give them sometimes myself, but I also look at the safety profile. I'm not just giving it. And then there is the third category I will describe. When I tell you thumbs down, that's a danger sign. Just don't take it. It doesn't mean that it doesn't always work. There are some studies show positive that they work, but the problem is that they also can kill you. Like they have some side effects. They can also be dangerous. So those, it's best just not to take it. Have I never given that herb to anyone ever? The answer is, oh yes, I have sometimes in rare situations. But that is, I have the luxury of assessing a patient and kind of see, you know what, nothing works for her. This is very potent. There's a little risk. Try that, because in conventional medicine, in traditional medicine, there's really no answer for your chronic illness. So what the heck, let's try that. It's worth the risk, but I warn the patient. So three categories. One, thumbs up. Go ahead. You don't even have to consult me. Use them if you need to. And I'll tell you what they work for, what the science shows. Second category, use them cautiously. It's best for you to consult a professional who knows herbs and their side effects. And the third category, it's best just not to take it. They are dangerous. They should be used under very, very rare circumstances only by the physician. Does that simplify? So every time I bring up a herb and say, this is, it doesn't mean it's panacea, and it also doesn't mean that it's going to work for everybody. Remember, human body is very complex. People have multiple medical problems, multiple issues. It's going to work on some, will not work on others. When we say the studies are positive, it doesn't mean that they gave the herb to 100 people and every single one of responded. That's not what it means. A scientific study simply means that in a large majority of patients it worked, and then they repeated the study or verified and seemed to be getting the same conclusions consistently. That's what I mean, that the research results are positive. Okay, so what we can do, as a Mayo Clinic gave their, in their guideline, they went alphabetically, just easy. So the names, let's go through them alphabetically. And please don't go crazy taking notes. Spend more time listening, otherwise you can be like, I'm going to forget it, let me write it quickly. You feel free to do whatever. But I'm just going to have to go very fast through this list, because otherwise the only other choice is that we continue. I don't know what time it is. What time is it, Mercedes?
10 minutes.
10 minutes left? I'm supposed to leave half an hour for questions. And I have 10 minutes left. So I leave it to you guys. Would you rather have question answer session or go through this list of 100? Okay. So you 10 minutes, which means I have to fly through it. If you want to learn a little detail, then we can do another seminar. Then I'll tell you. Okay, you want to fly through it. Okay. The first one, we're going to start with ABC. First one is acai berry. This is a little bit question mark. Use it with it's as a weight loss product. Do not use on your own. Safety profile not well known. Consult with your physician or someone who knows herbs. Andrographis, thumbs up. You can use it on your own. You're not really taking risk. It's used for common cold. Why do you use it? Because you tell me, when was the last time you had common cold or flu and you went to your doctor and he had anything to help you? Not really. He said bed rest and a lot of fluids, because there's really no cure in conventional medicine for cold. So, what the heck? Studies are positive. Use it. Side profile is really, yeah, go ahead.
What was it?
It's called andrographis. I can spell it for you. Actually, this is an Indian herb known for its bitter properties. It's ANDRO, like androgens. Graphis, GRAPHIS. This is usually used for upper respiratory infections and cold and flu symptoms, and seem to work. All the research that's been duplicated seem to be positive. So when you got cold and flus, it's a waste of money going to the doctor. What the heck? Use it. Safety profile is safe. Let's move on to artichokes. That you can spell very well. Okay, this is the extract. This extract comes from, very important to know that this is not the hearts of artichoke. This is really made from the leaves, the broad leaves. Large, they are very large lobed leaves, and not from its fruit, which is the artichoke heart. And this is used for dyspepsia, indigestion, and I'm giving thumbs up on it. You're not taking risk. You can take on your own without consulting your physician. You are not putting your health at risk, and I am signing off on it. You can do that. Safety profile is good. There's really not much risk to take in it. The other thing is dyspepsia, indigestion, heartburn is another one of those things that conventional medicine doesn't have good answers. We give you Tums, we give you Mylanta, milk of magnesia, then we go to Pepsid, then we go Prilosec, then we go to Nexium. There are some patients, nothing seems to work. So why not try alternative? And one day, hopefully in the future, I'm going to go over with you very important discussion, acute problems versus chronic. And that is such a fascinating story for anyone to learn. So artichoke, the research basically shows that its a leaf extract works for nausea, vomiting, abdominal pain, and anything associated with indigestion, dyspepsia, etc. Avocado, question mark. Why is that? Because safety profile is not well studied, and it's primarily used to lower your cholesterol. Does it work for cholesterol? Some studies show yes, it brings down your bad cholesterol and increases your good cholesterol. It's also, some studies show that it works for osteoarthritis, and it may improve your pain, joint pain, and disability. But because of the side profile, be cautious, consult with someone who knows better. Black cohosh, thumbs up, you can use on your own, don't have to consult me. Women, really applies to women. For premenstrual syndrome, it works in younger women. Heart palpitations, sleep disturbances, mood disorders, headaches, hot flashes. Now it doesn't mean, remember, that it's going to work for everybody. Okay, nothing is a blanket statement here. Just keep that in mind. These are guidelines. Nothing is written in stone. So I'm going to move fast into this blonde psyllium. Blonde psyllium, thumbs up. You can use on your own. Works for irritable bowel syndrome, and it brings down your high cholesterol. The studies are positive about that. If you want to use, those of you who have high cholesterol can use it. And basically, it's used as a laxative, and it gives you bulk to your stool, and it can help you with the lentils. Remember, eat lentils. Blonde psyllium, it will help you have a nice, healthy bowel movements. Let's move on to butterbur. Butterbur, thumbs up. You can use on your own. Butterbur is basically a shrub which is found in marshy meadows and riversides. Its name basically comes from its large supple leaves that were used to wrap butter before the days of refrigeration. That's how they wrap the butter around with it. And basically this is used to prevent migraines, hay fever, allergies, and it's also non-sedating. Remember all the allergy medications, with the exception of those that are non-sedating, but they are very expensive. Claritin or Zyrtec, each pill is like $1.50. How many people can take a $1.50 pill every day, it's $50. If you have allergies 6 months a year, that's a lot of expense for an average person. So those are also reasons why you should consider alternatives, and especially the safety profile is good. It's not something that you need to worry about too much that's going to cause any harm. You don't need to consult a physician. You can do on your own. I know by saying you don't need to consult a physician, I'm putting myself a little bit at legal risk, but I'm willing to do that. Come sue me if I go wrong. Okay, now I'm only kidding. Research shows that it significantly decreases the number of migraine headaches. As you know, again, migraine headaches are one of those pain in the what disease. Sometimes Maxalt and imipramine, those are the two medications, don't work too well on some people, right? So if you can get a cheaper alternative that you don't even have to consult your physician, go for it. And the science shows it seems to work very well.
And you say butter-bur?
Butter-bur, B-U-R. Butter like butter, B-U-R, it's one word. Let's move on. Cat's claw. Cat's claw is basically, it's a woody vine from the tropical rainforests of Central and South America. It has hooked thorns. That's where it gets named from. It has thorns on it. That's why they call it cat's claw. And research is kind of positive for it to work for rheumatoid arthritis, joint pain, osteoarthritis. Problem is safety. We are not sure. So if you want to take it, consult someone like me who can look up or just remember. Either way, you should not take it without. So this is the middle category. I want to remind you again before I move forward. Category of herbs that you can take on your own, thumbs up, don't worry too much. Category of herbs, you can take positive studies, but consult a physician. And number 3, the category of herbs, I'm going to tell you here and there, stay away from it, and I'll tell you what it can do to you. Okay? It's easy to remember that way. So research shows that it can ease joint pain from rheumatoid arthritis. Let's move into caine. Some people pronounce it differently. Caine. Spelling is, in case you don't know, C-A-Y-E-N-N-E. Thumbs up. You can use it without the physicians. That's again my opinion. That you can use. It's my opinion. I'm giving it to you. It doesn't mean that another physician is going to say use it without the physicians. That's my opinion, and I'm entitled to it. You can use it without consulting a physician. Safety, you can't really harm yourself. All the studies show, it seemed to work, and it's not really risky to take it. So you can do it on your own. What is caine? It's really another technical name for red pepper. That's what it is. It's a spice. And how does this spice work? It has an ingredient in it called capsaicin. And what capsaicin is, it blocks the messages. It blocks a chemical which is used by the nerves to send pain message from one end to the other. It blocks that chemical. So it diminishes the feeling of pain. So any kind of pain it can work for. So rheumatoid arthritis, osteoarthritis, very painful diseases. You can use it. Why not use it if you can save your money and not to have to go to the doctor? So it's for fingers, knees, especially superficial pain, fingers, knees, joints, debilitating pain when you wake up in the morning. It works for that. Chasteberry or chasteberry, whatever you want to call it. This is a peppery fruit of a tree that is native to the Mediterranean region. There's a question mark on it in the sense that there's a safety question. Consult a professional if you want to use it, but it does work for PMS, younger people, who have PMDD, premenstrual syndrome, etc. So it has positive research results. Cinnamon. Cinnamon is another one with a question mark. You have a good day. Thank you for coming. Okay, cinnamon is another one. Question mark, positive studies, but consult a physician who knows about these herbs before you use it because of the safety profile. Most research suggests the cinnamon is not really that